A warm welcome to all our viewers, to our series Natural Medicine. Today we have taken a topic from the practice, because I keep hearing and experiencing for myself that sometimes a doctor doesn't really understand you. You have a problem, you try to describe it, but somehow you are not taken seriously or only treated superficially. Maybe there is just a quick medication and that's it. But did they really understand us and see our problem? Well, I would like to make a program about it, a discussion, with a very empathetic doctor who understands you. She understood me too, and she is here today. I'll introduce her to you in a moment. Stay tuned. So, don't be surprised. It is of course the head physician of the Swiss Mountain Clinic, Dr. Petra Wiechel. You are very welcome.
Thank you, Alexander.
I have no doubt that you understand the patients. But it is a big problem that patients today are simply not understood with the symptoms they describe to the doctor. Yes, and I think that's a fundamental problem with the way medicine has developed. And that sometimes, I don't want to criticize here, but I just want to describe 3 situations. There is a young woman who has had a very stressful life and is physically and mentally exhausted with generalized pain, severe sleep disturbances and panic-like fears because this pain repeatedly takes her breath away and has been through an odyssey in which the family doctor who helplessly refers her to a specialist. And then it takes 5 weeks to get the appointment. And the hope is so incredibly great. And there is nothing, and they dismiss it, and they find nothing. And then it takes 8 weeks to see the next specialist, and the hope is huge. And then they have the task of ruling out a tumor, and nothing happens. And they say, you need to see the next specialist. And so half a year has passed and there's nothing in the laboratory chemistry that they asked for. And she described such a situation that the family doctor said she didn't need to come back now. The specialists say there is nothing there. And then she went there again in the afternoon in fear because she was alone with these fears and the pain was so great, and then she was turned away at the counter, like, there's nothing there, so please leave, we don't have time now. And I found that so offensive. And that's no way to treat people. And I got to know her in the summer, and she was here again now, and it was very touching when she told the other patients her story. And it was worlds apart from the summer until now, and it was very clear within a short time why. And I just want to say that it wasn't understood because, of course, diagnostics are based on something beyond this event and something that is needed to understand a person that is connected to a life. You have to listen to the fact that they always commuted at night for 15 years in their night work and how many processes no longer had time to slowly regenerate. And then there was the fear. I must have something really bad. So that means that by listening, a doctor would actually get to this diagnosis.
Of course.
Just briefly, yesterday, there was a lady who had incredible pain in her pelvis at the age of 14, and it went on for 2 years, where she had 2 years of extreme pain from 14 to 16, until it was discovered she had bone cancer. Is it always such a long phase, or could you find something out more quickly by listening?
So if you don't take time at the beginning, you know nothing. You then treat the lab values or you treat the MRI. As a doctor, I have to be able to research and combine for what they tell me, but in my opinion, 80% of the diagnosis is already known after the first conversation, because after that I know what I can look for.
But these are the experiences of an experienced doctor like you from life. But that's not part of the training, listening to the patient and combining what you're hearing, what the cause could be.
Yes, but I just want to take this as an opportunity to explain that you give all the responsibility to a specialist level, but then they really only exclude the small things on a detailed level, but are not the measure of all things.
It's just pure laboratory diagnostics.
Yes, and not seeing it doesn't mean there's nothing functional, immunological, or cellular, because I don't examine that. And that's why this family doctor is so important. And that's why instruments for doctors are so important. And I don't mean that in a bad way, but we need to take a much broader view. We need doctors again who have a much broader and deeper knowledge. How are we supposed to learn that? We only learn that about life and about people. And I recently had a conversation with a neurologist, because the Parkinson's patient said, "My neurologist is very open. And would you, I always come to you, also to ionospheresis, and we work on these high toxic loads," and I said I would be very, very happy to. I can get in touch with him so that he knows what we're doing here. And then I also found it very nice that a person simply doesn't reject what the patient does. That is already very positive. And this conversation was very nice for the first 5 minutes. I was able to tell him what we were doing. And then, of course, I went one step further and told him everything we knew about this person. And then came the slam, then the door was slammed shut. Well, you don't know that. What does mercury mean here? Where does the mercury come from? Oh, you mean lead? No, that's not possible. No, none of this has been scientifically proven. And then I thought, keep dreaming. Your life is running away from you. These are the things that influence a neurodegeneration. How is progress supposed to be made if, as a neurologist in a state of helplessness, the same therapy is prescribed for all Parkinson's patients and nothing changes except symptomatic improvement, which requires more and more, because the receptors then become sensitive? And then I thought, fine, let's leave it closed, the door. And how wonderful, there is a person who wants to go further, who wants to understand, who takes charge, what they do is important to them. I am no more in a position to know what will happen in 5 years' time. But I can understand what kind of stress this organism carries within itself, which also influences neurodegeneration leading to Parkinson's disease. It's not that alone, but it's the accumulation of these things. And then I thought, you don't understand me either, because you remain in your world view. And we are not talking about an informative level here, we are talking about facts. These are laboratories that certify high aluminum. Aluminum is brain barrier compatible. And then I thought, what a pity, how good that this colleague allows it and that the patient also discusses it very openly with him. But I don't think it will go further. I thought I could open the door for him. I thought I could get him to say, wow, that's really interesting. That's how I've always got on in my life. I have listened. That's great. I didn't even know that. Well, certainly. We have to look into it. No. So. And the third thing I noticed. One patient has a breast tumor. And in all probability this is a breast carcinoma. And this is not an emergency. It's there now and you can do some research first. But she doesn't just want a biopsy, she wants it to be removed.
May I just, you say breast tumor and breast carcinoma perhaps?
I don't like the word carcinoma.
But is there a difference?
No.
That's the same then.
Well, first of all it's still a lump. The carcinoma hasn't even been confirmed yet, but I just don't like the word cancer. By the way, I'm looking for a new word. If you can help me, I would be very grateful. And this tumor is there, it is tangible. And this tumor should be removed. That's what the patient wants too. But there is no way around it. And I find that sad.
Why is there no way to get there?
Well, there's no surgeon who says I'll remove it. And then we will examine it histologically and discuss the next step. We want to know what it is first, and then we decide about the steps, breast conserving or radiotherapy. And it's all of no interest to the patient.
She can decide that for herself.
Yes, but she can't find a surgeon.
But today we also know about a biopsy, where you go in with a needle. And when you pull it out, you can contaminate a lot of tissue.
Alexander, that's why we're talking about understanding. Why do I follow a guiding principle that is given to me and do it according to the books for a person who says responsibly, I stand by the decision to relieve myself of this tumor and no matter what comes out of it, this is where my work begins. I know that. But it will not start by following a plan that they present to me, but I will decide which way I want to go. And that is understanding. We now have a lot of responsible people. Today we have a very high level of awareness among people. They are dealing with themselves, with their illness, they are also taking personal responsibility. That's not a certain blame game, that's what happened, but it could have happened. I lost myself in my life. Alone, I only took care of other people and so on. But I just want to say that it is such a pity that we do not live this openness in medicine or that we deal with this person to such an extent that we say, I accept this, we will remove it, we will examine it histologically, and then you continue afterwards. Of course, you have to take it into your own hands and find partners who will continue to accompany you. And you can do that. What has taken 10 years is not simply a matter of removing the tumor. A tumor is always a major event. There are many mechanisms that have contributed to this, including vitamin D, which we have been talking about for a long time.
And I would perhaps like to intervene again, because I keep hearing that I can feel a lump and it really has to go in 2 weeks. But by the time you feel it, it's already at least 7 years old.
Yes, of course.
Why the panic? It has to be out in 2 weeks.
That's what I always ask myself. Who turns this into an emergency? And who, of course, always has the worst in mind immediately? And people go through hell really fast and in the end it is sometimes a calcification. Sometimes it is a fibroma or a benign lump. So I just want to say that it's difficult that many people today no longer feel understood. Because we have been given a set of tools, as doctors, that we only follow these things. And if they are good, we really do have completely different examination and laboratory programs in complementary medicine. Very interesting. They have not even found their way into normal medicine. And knowledge needs to be expanded. And doctors, I believe, need to be trained differently. They also need to be given opportunities from the bottom up in their training cycles, I believe, to open their eyes in order to understand people better. And that somehow makes me very sad to observe at the moment, because I recognize this feedback and also recognize the helplessness that the doctors no longer have. And I'm not going to use the argument of time now and have any sympathy for it. I have no understanding for that, because there's a person sitting opposite me, it's not just anyone, there's a person sitting opposite me and they need a solution. And I can't sort that out in 5 minutes. Then I only work on a symptomatic level. And these people slip into a chronicity, for which we are also medically responsible. In my opinion. And that is sad. That is sad.
I can still remember. When I was a child, there were still these family doctors. And the family doctor actually really knew the family. The story behind it, the parents and so on. I actually found that to be the case as a person of trust.
That's the case. And I was allowed to be that for 17 years. And for me, that's the greatest dream job of all. If you like being a doctor, you can take care of these people.
You're almost part of the family.
You're part of the family, you're invited to family events, You help to get an apprenticeship, an apartment. It is much, much more. But it's support, it's care, and it's a relationship of trust. And sometimes it really doesn't take that much, because you know what triggered it again. Because I know about the things that go on with you, and that helps incredibly. Medicine is not a scientific profession, it is a profession of experience. It is a profession to empathize with others. And of course we as doctors need our prerequisites. But we have an education that allows us to see people as. The other day in these beautiful conversations we talked about machines. But we throw something in. And that helps. And gone, that's not good at all. And the problems are getting bigger and bigger and people are getting younger and younger. And we need to create a healthy foundation again. And we have to achieve this by working together.
You mentioned the word experimental medicine before. Being a doctor is experimental medicine. But these people, who actually do this strict training to become a doctor, are not actually involved in experimental medicine, they actually learn more chemical or biological organ mechanics. They get to know people as mechanical machines. And what you say is completely alien to them. Logically, too, but they all become super good doctors when they open up and practice for over 20 years. So we should actually say to ourselves as consumers, when I go to a doctor, I have to ask how old they are. Do they already have experience or not? And even then I can't be sure.
Yes, of course.
If they close themselves off like that.
Yes, of course. And the doctor's view of the world used to be like a universe. And now this has been precisely minimized by electron microscopy. And if I detach something from the whole, I can't clarify it. This is the responsibility of a surgeon. Or of an emergency physician. That's out of the question. Incredibly high quality and wonderful. But everything else, that requires a. I believe there has to be a doctor again who has things in hand, who is able to make decisions based on experience, knowledge and care and who refers patients to specialists. But now the transfer always goes very quickly. Now an MRI is being done very quickly, all is being done very quickly, because everything is flourishing as a result, and it's actually sometimes clarified at the grassroots.
But I don't see a trend reversal now, on the contrary, I actually see it now, when I think about it, that it's actually getting even more extreme. In the end, the body, the human being doesn't even have an immune system anymore. That's how it's actually propagated, isn't it? You have to trigger the immune system, you have to vaccinate it, you have to do it and always from the outside, but not from the inside.
Yes. It touches me when people say, "No, I don't need to go. I haven't seen a doctor for years. I have my naturopath who looks after me. She takes care of me, she helps me." They approach it with greater gentleness. So it's wonderful how this professional group of naturopaths and alternative practitioners always has a balancing effect, which on the other hand is not even close to the view of a doctor after antibiosis, for example, to really restore the symbiosis and so on. It's no good if I no longer have confidence in them and know that I'll only be sent home with a prescription anyway. That may be fine for many people, but people's awareness is growing.
I once suggested to a German doctor that he should work with an alternative practitioner. He thought it was a great idea, but I think that's even forbidden in Germany.
I don't know whether it is forbidden. I was just incredibly grateful back then, when I was practicing. One alternative practitioner dealt with dark field, the other with colon hydro. And then the questions came back. What do I do now? Please do colon here. I really need a dark field and all that. So it was incredibly nice. This collaboration is incredibly wonderful and it's a dream, but it would have to become a much larger network of cooperation. But of course that needs people who are very open-minded and who also concede that they may not even know these things. But they are valuable.
Do we want to make a final appeal to the audience? What would you recommend to viewers if they don't feel understood?
Well, I think you need your own doctor. And doctors also need their patients. That means there has to be a great deal of understanding and trust. In other words, I would feel incredibly misunderstood if my problem was simply treated with a medication. Instead, I wouldn't get a solution or anything. I don't feel questioned as to why, and why not. The patient we discussed at the beginning said that since I realized what I needed, I have found all of this. And sometimes on the spot, the local holistic dentist. It wasn't far to find the doctor or the alternative practitioner. But I didn't even know all that. And I believe that if you set out on the path, and thanks to your health channel, more and more is emerging. This is the snowball principle. More and more messages are being sent out. It has to be a cooperation. And medically, I believe that we doctors are also called upon to deal with this. And people may also have to learn to recognize for themselves that there are many other things, and also get second opinions when they realize that my doctor is reaching his limits.
Yes, I mean, when I think about it, we have more and more small centers in Switzerland. You go there and you have a different doctor every time. And I don't like to say it, but sometimes I feel a bit of arrogance or ignorance. It can be felt in the area of diagnostics or in dealing with the problem. Because the next patient is already here and the waiting room is full. So the problem is not that you have too few customers or patients, but that you are chronically overloaded. And this state probably also leads to people not taking any more time, doesn't it?
I used to have a child and that was 1.5 years old. And whenever I gave it to the kindergarten in the morning, the nun came and took it from me, a young nun. And as a mother, she gave me the feeling that this was her most important child. But she has given every mother that feeling. And I believe that if we also have this attitude as doctors, that you are the most important person to me and there can be 20 people outside, then a different relationship will develop. And then I'm also prepared to say as a doctor that I decide how long I give you here and how long I want you to stay. The others have to accept that too. And I understand the time problem, but everyone expects that. And then you have to rethink things. But the way it is now is not good, is it?
No, I don't just mean that the problem is not recognized, there is also the component of the psyche. If you are really picked up by a doctor in this way, then we know today from psychoneuroimmunology and psychosomatics that half the battle for healing is just being understood.
If I can also categorize my pain, then I can endure it. But if everyone says there's nothing there, then I can't categorize it. Then I think, if you don't know and send me here and there and everyone says there's nothing there, then at some point I'll be a hypochondriac for you and can't do anything, because I'm trapped inside myself and that's a cruel feeling for people, not to feel understood.
Did our viewers still have the freedom to choose a doctor again and again? What is it like in Germany? So if I'm not happy there, can I just switch and switch again until I find someone? Or is that also a bit problematic?
Oh, I don't know. Of course, there are also the GPS who are assigned to me, or to whom I am obliged to pay an extra contribution. But I can't remember that now exactly. But it's all right if maybe. It's all about me and my health. When I find someone I feel comfortable with and who makes an effort. Because sometimes there are things that I may not understand, but I try to clarify them for you. Or I'll try to get you to someone who understands it better. And it's not always just the specialist group, the specialization. You just have to know that. And I think people who are doing so well through you and through this education, and the Congress is online now, that's great, great, great work. So it's also great work not to waste energy. When I look back, 17 years as a family doctor, a different plan, that wasn't so easy. People didn't understand it that way. That time is completely over. People understand, people read, people are becoming more and more aware, and we have to be careful medically that we don't get stuck somewhere. We have to be involved, and we have to be involved from the grassroots. And I believe we also need to reform a great deal. And the paradigm shift is already being practiced well by conscious people. But I think it also costs a lot in medical terms. And I sincerely hope that I am now in the phase of life where I can still send everything out, but only for a while. And that we reach the young ones, that is so important.
Thank you very much, dear Petra.
My pleasure.
And to you too, dear viewers, I can only wish with all my heart that you will also find a doctor who listens to you, who is empathetic and really deals with the problem and looks for the causes of your path, so that you really feel understood. All the best with that. See you next time.